Ladies and gentlemen, welcome to sqadia.com. My name is Mohammad Osama, and today we are going to talk about the scapular region and superficial back. In this lecture, we're going to talk about the structure and bony landmarks, the superficial anatomy and orientation, the muscular structures of the scapular region and superficial back, the movements of the scapulo-thoracic articulation, and the coupling of the scapula with the rotator cuff muscles. So first of all, when talking about the structure and bony landmarks, we're going to talk about the angles and the borders of the scapula. We're also going to talk about the acromion process and the coracoid process of the scapula. And also going to talk about the spine of the scapula and the glenoid fossa, which actually makes the shoulder or the glenohumeral joint with the humeral head. Moving on, in the superficial anatomy and orientation of the scapula, we're going to talk about an important structure which is known as the triangle of auscultation. We're also going to talk about the orientation of the articulating surfaces, including both the humeral head and the glenoid cavity. We're also going to talk about the spinal contribution to the shoulder motion, because when we talk about the movement of the glenohumeral joint, because it is actually associated whenever we talk about the scapula. So there's actually a rhythm between them, and then because of that rhythm and the association of the scapula with the thoracic spine is also influenced by the spinal activity. So that's why we're going to observe that as well. In muscular structures, we are going to talk about the muscles which are actually acting at the scapula, including the trapezius, including both upper, middle, and lower fibers. We're also going to talk about the rhomboids and the levator scapula. And we're also going to talk about the stratus anterior and pectoralis minor. Moving on, talking about the movements of the scapulo-thoracic articulation, we are going to take a look at the individual movements which are possible at the scapula when it works or moves as a functional joint at the thoracic spine or the ribs. We're also going to talk about the scapulo-humeral rhythm when it actually influences the movement of the glenohumeral joint. And we're also going to talk about the glenohumeral and scapular movements, like what type of glenohumeral movement is actually associated by which type of scapular movement. At the end, we're going to talk about the coupling of the rotator cuff muscles with the movement or the muscles of the scapula, in which we're going to talk about the coupling of deltoid with oblique rotator cuff. We're also going to talk about the coupling of the deltoid with supraspinatus, and also going to talk about the stabilizing action of the rotator cuff. And that's pretty much all that we are going to cover in this lecture in 5 different sections. So stay tuned to sqadia.com for more lectures like this. Thank you very much.